In this lecture, the osseous, articular and muscular structures of the elbow, wrist and hand will be discussed.
We will begin with the osseous structures, and the humerus specifically. The humerus is located in the arm, positioned distal to the pectoral girdle.
It is the largest bone in the upper limb. The proximal end of the humerus is not subcutaneous and therefore not easily palpable.
The proximal end is the expanded upper part of the bone. It consists of the head, the greater and lesser tubercles, and the anatomical and surgical necks. The head of the humerus may be felt by deep palpation of the axillary fossa.
The greater and lesser tubercles may be located by deeply palpating through the deltoid muscle, inferior to the acromion and coracoid processes, respectively.
The head of the humerus articulates with the glenoid cavity of the scapula, forming the glenohumeral joint, or the shoulder joint. Landmarks of the body of the humerus include the deltoid tuberosity and the radial groove. The distal end of the humerus is the expanded lower part of the bone. It consists of the capitulum, the trochlea, and the lateral and medial epicondyles. Both the medial and lateral epicondyles are subcutaneous and therefore can be easily palpated, particularly during partial flexion of the elbow joint. Other important landmarks include the olecranon, coronoid, and radial fossae. The humerus articulates with the head of the radius, forming the humero-radial joint, and the trochlear notch of the ulna, forming the humero-ulnar joint.
These two joints contribute to the formation of the elbow joint, which will be discussed in further detail later.
The radius is located in the forearm, distal to the humerus of the arm. It is positioned lateral to the ulna and is the shorter of the two bones of the forearm.
The name radius is derived from its ability to rotate relative to the more fixed ulna.
The proximal end of the radius is the discoid upper part of the bone. It consists of the head, neck, and radial tuberosity. These are important landmarks for you to know. It articulates with the capitulum of the humerus, forming the humero-radial joint, and the radial notch of the ulna, forming the proximal radio-ulnar joint.
The head of the radius can be located distal to the lateral epicondyle of the humerus in the extended elbow joint, especially during rotation, supination, or pronation of the forearm.
The body of the radius is the long part of the bone, which extends between its proximal and distal ends. It consists of anterior, posterior, and interosseous borders, or surfaces, and these define its anterior, posterior, and lateral surfaces. These are proximal to the radial styloid process, are subcutaneous, and easily palpable. The distal end of the radius is the expanded lower part of the bone. It consists of the ulnar notch, the styloid process, the dorsal tubercle, and multiple grooves for extensor muscle tendons. The radial styloid process can be felt by palpating the anatomical snuff box. The dorsal tubercle of the radius can be palpated on the dorsolateral aspect of the wrist. It articulates with the head of the ulna, forming the distal radio-ulnar joint, and the scaphoid and lunate carpal bones, forming the radiocarpal joint. The ulna is located in the forearm, distal to the humerus of the arm and medial to the radius. It is the longer and thinner of the two bones of the forearm. The proximal end of the ulna is the hook-like upper part of the bone. It consists of the trochlear and radial notches, the olecranon and coronoid processes, and the ulnar tuberosity. It articulates with the trochlea of the humerus, forming the humero-ulnar joint, and the head of the radius, forming the proximal radio-ulnar joint.
The olecranon of the ulna is subcutaneous and therefore easily palpable. When flexed, it forms the apex located on the posterior aspect of the elbow joint. In the extended elbow, the olecranon forms a straight line with the epicondyles of the humerus.
The body of the ulna is the long part of the bone, which extends between its proximal and distal ends. It consists of anterior, posterior, and interosseous borders, and these define its anterior, posterior, and medial surfaces. The posterior border of the ulna is also subcutaneous and can be palpated along its entire length. The distal end of the ulna is the slightly expanded lower part of the bone. It consists of the head and the styloid process. It articulates with the distal end of the radius, forming the distal radio-ulnar joint.
Unlike the radius, the ulna does not articulate with any of the carpal bones, but is instead separated from them by the articular disc of the distal radio-ulnar joint. The head of the ulna is located by palpation of the medial aspect of the wrist.
The ulnar styloid process is easily identified by the large prominence on the medial side of the dorsal aspect of the wrist joint. The carpal bones are a collection of 8 bones in the hand, which are located immediately distal to the forearm. With the exception of the pisiform, which is a sesamoid bone, the carpal bones are classified as short bones. Each of the carpal bones are morphologically unique and are named according to their perceived shape. The dorsal aspect of the carpal bones collectively forms a slightly convex surface, while the palmar aspect collectively forms a well-defined concave carpal groove. For descriptive purposes, the carpal bones are arranged in separate proximal and distal rows, each row consisting of 4 bones. The proximal row consists of, from lateral to medial, the scaphoid, lunate, triquetrum, and pisiform bones. These bones articulate with each other at intercarpal joints. The scaphoid and lunate bones articulate proximally with the distal end of the radius, forming the radiocarpal joint. With the exception of the pisiform bone, the bones of the proximal row articulate distally with the distal row of carpal bones, forming the midcarpal joint. The distal row consists of, from lateral to medial, the trapezium, trapezoid, capitate, and hamate bones. These bones articulate with each other at intercarpal joints, and they articulate distally with the metacarpals, forming the carpo-metacarpal joints. The bones of the hand are a collection of 27 bones which form the most distal segment of the upper limb. For descriptive purposes, the bones of the hand can be arbitrarily divided into 3 groups: the carpal bones, the metacarpals, and the phalanges. The metacarpals are a collection of 5 long bones which are arranged in a single row with 1 associated with each digit. The phalanges are a collection of 14 bones. They are arranged in 3 rows of distal, middle, and proximal phalanges, except for the first digit, which lacks a middle phalanx.
Next, we will discuss the articular structures of the elbow, wrist, and hand, starting with the elbow. The elbow or cubital joint is essentially a complex of 3 joints, including the humero-ulnar, the humero-radial, and the proximal radio-ulnar joint.
The humero-ulnar and humero-radial joints form a complex hinge joint that allows flexion and extension of the forearm, while the humero-radial joint, along with the proximal radio-ulnar joint, facilitates pronation and supination of the forearm. It is a limited ball-and-socket type of synovial joint.
The humero-ulnar joint is formed by the articulation of the trochlea of the distal humerus with the large trochlear or semilunar notch of the ulna.
Its stability is reinforced by the medial and lateral collateral ligaments and by the anterior articular capsule in full extension.
The proximal radio-ulnar joint is a uniaxial pivot synovial joint between the head of the radius and the radial notch of the ulna.
The joint is stabilized by the annular and quadrate ligaments. The annular ligament ensures stability of the head of the radius within this joint. Next, the wrist.
The wrist forms the proximal part of the hand and is composed of a complex of 8 carpal bones, which articulate with the radius of the forearm proximally and the metacarpal bones of the hand distally.
The radiocarpal joint or wrist joint itself is a condyloid or ellipsoid synovial joint, formed by the articulation of the proximal row of carpal bones, including the scaphoid, lunate, and triquetrum, not the pisiform. This articulation is with the distal end of the radius and the articular disc of the distal radio-ulnar joint. The ulna is not involved in the radiocarpal joint.
The scaphoid, lunate, and triquetrum, along with their associated ligaments, form a smooth convex surface that is received by the concave surface formed by the distal radius and the articular disc of the distal radio-ulnar joint.
The carpo-metacarpal joints are the articulations between the bases of the metacarpals with the distal row of carpal bones. In other words, the trapezium, trapezoid, capitate, and hamate bones. The first carpo-metacarpal joint, or the carpo-metacarpal joint of the thumb, is a saddle or cellar type synovial joint that allows opposition of the thumb. It is formed by the articulations between the base of the first metacarpal and the trapezium. The joint is stabilized by the palmar, dorsal, and lateral carpo-metacarpal ligaments on the ulnar side of the joint. The second to fifth carpo-metacarpal joints are synovial ellipsoid joints, formed by the articulations between the bases of the second to fifth metacarpals and the distal row of carpals. These joints allow slight gliding produced by the long flexor and extensor muscles of the digits. The carpo-metacarpal joints are stabilized by dorsal and palmar carpo-metacarpal ligaments. The intermetacarpal joints are formed by the articulations of the bases of the metacarpal bones with one another. These are plain synovial joints. The intermetacarpal joints are stabilized by the dorsal, palmar, and interosseous metacarpal ligaments and permit slight gliding between the articulations. The metacarpophalangeal joints are formed by the articulations between the heads of the 5 metacarpal bones with the proximal phalanges. These are condyloid synovial joints which allow movements such as flexion, extension, and adduction, abduction, and some rotation during movements such as pinching and grasping. Each metacarpophalangeal joint has a palmar, deep transverse, collateral, and accessory collateral ligament, and these help to stabilize the joint. The interphalangeal joints are the joints formed by the articular surfaces of the phalanges. The proximal interphalangeal joints are formed between the distal heads of the proximal phalanges and the bases of the middle phalanges, while the distal interphalangeal joints are formed between the distal heads of the middle phalanges and the bases of the distal phalanges. The thumb only has one interphalangeal joint. The interphalangeal joints are synovial hinge joints which allow movements such as flexion and extension. Each interphalangeal joint has a palmar, collateral, and accessory collateral ligament, and these help to stabilize the joint.
Next, we will discuss the muscular structures of the elbow, wrist, and hand, starting with the muscles of the anterior compartment of the arm. Note that the specific origins and insertions, and most importantly, the actions for each of these muscles should be known and are included in the lecture notes.
The muscles of the anterior compartment, or the flexor compartment, are one of 2 subgroups of the arm muscles, the other being the muscles of the posterior compartment.
These muscles mainly act to flex the forearm at the elbow joint and to supinate the forearm at the radio-ulnar joints.
The muscles of the anterior compartment of the arm consists of biceps brachii, coracobrachialis, and brachialis. The biceps brachii muscle is found in the anterior compartment of the arm. It is a fusiform type of skeletal muscle and is composed of 2 heads, a laterally located long head and a medially located short head.
In some individuals, there is a 3rd head of the biceps brachii muscle, which arises from the brachialis muscle and attaches to the medial side of the tendon of the biceps brachii and the bicipital aponeurosis.
The biceps brachii muscle is located anterior or superficial to the brachialis muscle and the musculocutaneous nerve. It is posterior or deep to the brachial fascia and the pectoralis major muscle. It's medial to the cephalic vein and lateral to the coracobrachialis muscle, the brachial artery, the basilic vein, and the median nerve. The biceps brachii is involved in multiple actions. It flexes the forearm at the elbow joint, most strongly when the forearm is in the supinated position. It supinates the forearm at the radio-ulnar joints. It assists in flexion of the arm at the glenohumeral joint, and it helps to stabilize the glenohumeral joint. The biceps brachii muscle can be tested by placing the forearm in the supinated position and then flexing the forearm at the elbow against resistance, and it can be palpated during this test. The coracobrachialis muscle is found in the anterior compartment of the arm as well. It is a strap-like skeletal muscle. It is located posterior or deep to the pectoralis major and medial to the brachialis and biceps brachii. It's involved in multiple actions. It adducts the arm at the glenohumeral joint and flexes the arm at the glenohumeral joint.
The coracobrachialis muscle acts as an antagonist to the deltoid. This is due to the insertion sites of both of these muscles being found on almost opposite sides of the humerus.
The coracobrachialis muscle can be tested by adducting the arm at the glenohumeral joint against resistance, during which it can be palpated. The brachialis muscle is found in the anterior compartment of the arm. It is a flat, fusiform type of muscle. It is located anterior or superficial to the humerus. It's posterior or deep to the biceps brachii. It's medial to the brachioradialis and lateral to the pronator teres muscle. The brachialis muscle contributes to the formation of the floor of the cubital fossa. The brachialis muscle flexes the forearm at the elbow joint. This action is not affected by pronation or supination of the forearm. The brachialis muscle can be tested by flexing the forearm at the elbow joint against resistance, during which it can be palpated.
The muscles of the posterior compartment mainly act to extend the forearm at the elbow joint. These muscles include the triceps brachii and anconeus.
The triceps brachii muscle is found in the posterior compartment of the arm.
It is a fusiform type of skeletal muscle and is composed of 3 heads: medial, lateral, and long.
The long head is located medial to the lateral head, and the lateral head is the most lateral aspect of the muscle. The triceps brachii muscle is located posterior or superficial to the deep brachial artery and radial nerve, and lateral to the teres major and teres minor muscles. The triceps brachii muscle extends the forearm at the elbow joint.
This action is not affected by pronation or supination of the forearm.
The medial head is active in the presence or absence of resistance, while the lateral and long heads are generally only active in the presence of resistance. The triceps brachii muscle can be tested by extending the forearm at the elbow joint against resistance, during which it can be seen and palpated. The anconeus muscle is found in the posterior compartment of the arm as well. It is a short, triangular skeletal muscle whose fibers can be found merged with those of the triceps brachii. It's located posterior or superficial to the elbow joint, medial to the extensor carpi ulnaris, and lateral to the flexor carpi ulnaris muscle. The anconeus muscle assists in extension of the forearm at the elbow joint. Next, we will discuss the muscles of the forearm, which act on the bones of the forearm, wrist, and hand.
For classification purposes, the muscles of the forearm are divided into 2 distinct compartments according to their position and function: the muscles of the anterior compartment and the muscles of the posterior compartment.
The muscles of the anterior compartment mainly act to pronate the forearm at the radio-ulnar joint. They flex the hand at the wrist. They abduct and adduct the hand at the radiocarpal and midcarpal joints, and they flex the thumb and fingers at their interphalangeal joints and metacarpophalangeal joints. For classification purposes, the muscles of the anterior compartment of the forearm can be arbitrarily divided into 2 subgroups. The muscles of the deep group mainly act to pronate the forearm at the radio-ulnar joints and flex the thumb and fingers at their interphalangeal and metacarpophalangeal joints. The muscles of the deep group of the anterior compartment of the forearm consist of flexor digitorum profundus, flexor pollicis longus, and pronator quadratus. The muscles of the superficial group mainly act to pronate the forearm at the radio-ulnar joints, to flex the wrist, and to control abduction and adduction, or radial and ulnar deviation at the wrist. The muscles of the superficial group consist of flexor carpi ulnaris, flexor carpi radialis, palmaris longus, and pronator teres. Of note, there is actually a third compartment or subgroup, which contains a single muscle, which we have not yet mentioned, the flexor digitorum superficialis. This muscle is considered to lie in a kind of intermediate compartment between the superficial and deep groups of the anterior compartment of the forearm. The flexor digitorum superficialis flexes the metacarpophalangeal joints and proximal interphalangeal joints at the four fingers and flexes the wrist. The muscles of the posterior compartment mainly act to supinate the forearm at the radio-ulnar joint and extend the hand at the radiocarpal or wrist joint. They also abduct and adduct the hand at the radiocarpal and midcarpal joints and extend the thumb and fingers at their interphalangeal and metacarpophalangeal joints. They also abduct the thumb at their first carpometacarpal joint. For classification purposes, the muscles of the posterior compartment of the forearm can be arbitrarily divided into two distinct groups: the superficial group and the deep group. The muscles of the deep group mainly act to supinate the forearm at the radio-ulnar joint and extend the thumb and index finger at their interphalangeal and metacarpophalangeal joints. They also abduct the thumb at the first carpometacarpal joint. The muscles of the deep group of the posterior compartment of the forearm consist of abductor pollicis longus, extensor indicus, extensor pollicis brevis, extensor pollicis longus, and supinator. The muscles of the superficial group mainly act to extend the hand at the radiocarpal or wrist joint, abduct and adduct the hand at the radiocarpal and midcarpal joints, and extend the fingers at their interphalangeal and metacarpophalangeal joints. The muscles of the superficial group of the posterior compartment of the forearm consist of brachioradialis, extensor digitorum, extensor digiti minimi, extensor carpi ulnaris, extensor carpi radialis longus, extensor carpi radialis brevis. And now we will move on to the muscles of the hand.
The hand is composed of both intrinsic and extrinsic muscles. The extrinsic muscles of the hand are the long flexors and extensors that originate in the arm or forearm. The intrinsic muscles of the hand originate and insert into structures within the hand itself.
The intrinsic muscles of the hand are involved in fine motor movements and allow for great dexterity of the hand. For classification purposes, the intrinsic muscles of the hand are divided into 5 groups: the thenar muscles, the adductor pollicis muscle, the hypothenar muscles, the interossei muscles, and the lumbricals.
These muscles act to flex the thumb, the other metacarpophalangeal joints, and the carpometacarpal joints. They also abduct the thumb at its carpometacarpal joint and oppose the thumb towards the other fingers.
The thenar muscles consist of the abductor pollicis brevis, flexor pollicis brevis, and opponens pollicis. All 3 of these muscles form the thenar eminence, which is found on the lateral side of the palm and are found on the thenar compartment of the hand.
The next group of intrinsic muscles actually consists of a single muscle, the adductor pollicis. The adductor pollicis muscle is found in the adductor compartment of the hand. It is a fan-shaped skeletal muscle composed of 2 heads, each of which are named based on the orientation of their muscle fibers: the oblique head and the transverse head.
The adductor pollicis muscle adducts the first metacarpal bone or thumb at the first carpometacarpal joint. The adductor pollicis muscle can be tested by adducting the first metacarpal or thumb at its carpometacarpal joint against resistance. The hypothenar muscles are another one of the 5 groups of intrinsic muscles in the hand.
These muscles mainly act to flex and abduct the little finger at its metacarpophalangeal joint and to oppose the little finger towards the thumb.
The hypothenar muscles consist of the abductor digiti minimi, flexor digiti minimi brevis, opponens digiti minimi, and palmaris brevis. All four of these muscles form the hypothenar eminence, which is found on the medial side of the palm. Next, the interossei muscles. The interossei muscles mainly act to abduct and adduct the fingers at their metacarpophalangeal joints, simultaneously flex the metacarpophalangeal joints, and extend the interphalangeal joints of the fingers.
For classification purposes, the interossei muscles of the hand are divided into two groups:
the dorsal interossei and the palmar interossei. Finally, the lumbrical muscles are the last group of intrinsic muscles of the hand. These muscles mainly act to simultaneously flex the metacarpophalangeal joints and extend the interphalangeal joints of the fingers.
There are 4 lumbrical muscles in the hand, and they are labelled 1 to 4.
The lumbrical muscles are found in the central compartment of the hand. Note that the specific origins and insertions for these muscles should be known and are included in the lecture notes. And that concludes this lecture on the osseous, articular and muscular structures of the elbow, wrist and hand. This lecture was prepared for students enrolled in the UCD School of Public Health, Physiotherapy and Sports Science. Images were taken from the Complete Anatomy software prepared by 3D4 Medical.